So my name is Pushparaj Mohanraj. I'm a consultant in Obs and Gynae, and my special area of interest is diagnosing cancers of the female genital tract. I've always been like a people-friendly person, so I always like to put my knowledge, thoughts, and my skills to help out others, and this was like a second nature uh, to my personality and character. Being a doctor was what I enjoyed and what I like doing and what I like to keep doing. Specializing in obs and gynae wasn't my first choice. When I decided to do specialization, I got into the top universities in India, and at that time, it was like 1.5 billion population aiming for 50 medical seats, and the person in front of me took general surgery. So because I was so passionate about having surgical specialty, I took obs and gynae. The whole idea is to do obs and gynae and subspecialize in cancers, and then it kept up with my surgical skills. The most important challenge I find in my specialty is people specialize and subspecialize, and when you specialize so much, then it is like if you go to a forest, look at the woods, then you go so close that you lose the vision of the forest. And I've seen time and time again patients seeing Dr. X, Dr. Y, Dr. Z, and they get different kind of opinions, and nobody's looked at the bigger picture, uh, uh, and also look at what the individual's needs. The needs can be physical, they can be social, and certain individuals, the needs can be quite complex. And putting all those things into perspective and listening to what the patient says and giving a tailored solution to their problem is not that kind of skills most doctors have. And having worked in different continents and different countries and working in different diverse cultures, I find myself in a unique position to try and figure out patient's need, and putting the whole complex picture into perspective and getting a solution to the patient's needs. That's what I think is the biggest challenge in my field, because I work in cancer multidisciplinary team meeting, and invariably patients get seen by like some of my colleagues, sometimes from a GP doctors, and they come up with like a problem, but nobody has found a solution to it. And trying to gather all this information, because the eyes only see what the mind knows, and if you don't have the kind of knowledge and skills to decipher what that individual needs, then you are not the right person to fix the problem. So I feel applying my complex medical knowledge and like looking and gathering all the information from your patient's medical record, I'm in a unique position to find out what was missing, what information was missing, and what further information I need to gather to give a solution to this problem. That is what I find is most rewarding from my job. Quite passionate about cricket. Cricket, for instance, like a sports, you can be a good batsman or a good bowler, but to be a good all-rounder is a useful skill to have, because you can play. If you got a sunny day, then it's always the batsman's pitch. But if it's a rainy day, the bowler's got an advantage. But being an all-rounder, you can pitch into the game and like play to the team's strength, and that's what I find is quite unique. And that's what I add to the multidisciplinary team meeting.